This presentation provides an overview of the Victorian Auditor-General's report, Public Participation in Government Decision-Making. Public participation is the involvement of those affected by a decision in the decision-making process. Increasingly, governments recognise the contribution the public can make in helping them to understand problems and risks and to craft solutions that are more likely to work. In previous VAGO audits, we have identified examples of agencies using inadequate or ineffective public participation methodologies to engage with the Victorian public. These examples have heightened the public's concerns about government transparency and accountability. In this audit, we have examined how effectively two central agencies, the Department of Premier and Cabinet, DPC, and the Victorian Public Sector Commission, VPSC, and three portfolio agencies, the Department of Environment, Land, Water and Planning, DELP, the Department of Health and Human Services, DHHS, and the Level Crossing Removal Authority, LXRA, support better practice public participation approaches across their areas of responsibility. For each of the three portfolio agencies, we also examine the public participation activities for a specific program to see how effectively each program achieved its public participation objectives and adhered to policy, legislation, and better practice principles. When managed well, public participation activities in Victoria are demonstrably making a valuable contribution to government decision-making. However, Victoria has no overarching public participation framework to drive activities and promote consistency of practice. Consequently, the quality and extent of public participation to inform decision-making varies across the public sector. Effective public participation across the public sector requires strong leadership from DPC. DPC has shown its commitment to public participation through two recent initiatives. However, DPC still needs to consolidate its leadership role by developing a framework or guidance for the Victorian public sector. All three audited agencies have shown leadership by establishing public participation as a priority. Although all three agencies note the importance of public participation in high-level strategic documents, DHHS and DELP have not yet developed a comprehensive public participation policy or framework. We examined one public participation activity for each of the three agencies. We found that overall most met their objectives and were generally effective. However, DHHS and DELP did not plan enough time for their activities. There are opportunities for all agencies to improve their approach to evaluating public participation activities, such as developing a comprehensive evaluation plan early in the public participation process and assessing public participation activities against key better practice features. We made two recommendations for DPC: that it collaborate with agencies to develop a whole of government framework and develop its own internal framework. We made two recommendations for DHHS and DELP: that they develop a comprehensive public participation policy or framework and provide their staff with guidance. Finally, we made 5 recommendations for DHHS, DELP and LXRA: that they establish a single source of information for monitoring and reporting, evaluate and review the effectiveness of public participation training, have consistent messaging regarding the purpose of public participation, provide feedback to stakeholders on how their input has been used, and plan realistic public participation activities to suit the time available. For further information, please see the full report of this audit on our website www.audit.vic.gov.au.